Hello, my name is Dr Dima El-Sharkawi and I'm a haematology consultant at the Royal Marsden Private Care. So I want to discuss with you a hypothetical case. I have a 65-year-old lady who's come to your surgery with back pain. It's been there for a few months but been getting worse actually recently, and you've done some basic bloods which I've got on the screen now for you, and I want you to look and see what you think the abnormalities are and are any alarm bells ringing for you. I'll give you a moment to think about it. From my perspective, the abnormalities that I can see is that she's mildly anemic. Her renal function, her creatinine is slightly raised, so it's a bit impaired. And she's got a raised calcium as well. And you'll also notice that her total protein is quite raised as well, with an albumin that is slightly low. Now, obviously, from a haematologist perspective, for me, this is screaming that I'm worried about that this patient could have myeloma. She's got some of the concerning so-called crab features of the raised calcium, the impaired renal function, the anemia, and possibly the back pain could be relating to bony pain. So that's the acronym CRAB. So I think myeloma is rare, but it's always important to think about it because often patients can have a delayed diagnosis, and when there have been studies to look at the pathway to diagnosis, patients have attended their GP multiple times before the diagnosis is made. And there have been studies to see what the outcomes are like for patients who are diagnosed via primary care versus those going in through A&E and having urgent admission and then diagnosis. And the outcomes are better if they are identified in primary care. Now, of course, there are lots of confounding factors in those kinds of studies as to why the outcomes may be different between the two groups of patients, but I think it is important to recognise that patients often do attend GP surgeries multiple times before attending A&E with their urgent problems. So Myeloma UK charity, so that's the large UK charity specifically for patients with myeloma, have worked a lot with clinicians and haematologists that specialise in myeloma, but also importantly primary care physicians to produce really helpful guidelines on when you might suspect myeloma and what your next steps to kind of prove or disprove the diagnosis would be. So I do think it would be worth you spending some time looking at the website, specifically at the section that is designed for primary care physicians and healthcare professionals. So on the screen we have a list of some of the red flag symptoms, and they're really reflecting that patients may have low blood counts again, so that patients may have anemia and the symptoms of anemia. They may have recurrent infections because of low white count or more prone to bleeding or bruising. They may have symptoms related to the paraprotein if the level of the paraprotein is very high. So they may have symptoms related to hyperviscosity. And then, of course, they may have symptoms related to the lytic lesions that can occur in the bones, whether that's bony pain or symptoms related to hypercalcemia. So I have been practicing haematology, dare I say it, for just over 20 years now. And in that time, actually the outcomes for patients with myeloma have changed dramatically from when I first started learning about it compared to now. And on the screen you will see, with the advent of newer therapies and new combinations of therapies, that actually the outcomes, having been that most patients are not going to survive in the first 5 years following diagnosis, have dramatically changed given the newer therapies that we have for patients, which is very exciting. I think that although myeloma predominantly affects patients in the older age groups, so those in their 60s, 70s and 80s, that it is important to recognise that actually a quarter of patients with myeloma are below the age of 60. And so whilst your index of suspicion may be lower in younger patients, do not exclude it completely. So again, if any of these red flag symptoms that we've already talked about are present in your patient, that they're persistent, do think about it and do think about performing an initial screen of blood tests, so full blood count and kidney function and calcium levels, but also protein electrophoresis. So although there are patients with what we call non-secretory myeloma, so that's myeloma cells that don't produce any abnormal paraprotein, the majority of patients with myeloma will have a paraprotein, or if it's available to you in your primary care trust, you could consider, as well as protein electrophoresis, checking serum free light chain. So in the olden days, when I first started, we used to talk a lot about Bence-Jones proteins, which was looking for the free light chains in the urine, but now we can pick these up in the blood from serum free light chains. So if it's available, if you're concerned, check full blood count, kidney function, calcium, protein electrophoresis and serum-free light chains in anyone that you're worried that myeloma could be a potential diagnosis. Thank you very much for watching.
We hope you found the session informative and useful. If you have any questions about it or want to know more about referring patients into private care at the Royal Marsden, do please contact me. And likewise, any information or feedback on these sessions is always gratefully received. Thank you very much and take care.